Hello, I'm Bob Kaplan from the National Institutes of Health in the United States, and it's a pleasure for me to be able to meet with you today. I'm sorry that I can't be there in person, and I look forward to hearing more about what happens in your meeting. I'm going to talk to you today about the Exposome and some of the work that we're doing here. If I can get the slides. So we've entitled this talk, The Exposome, New Approaches to the Study of Environment, Behavior, and Health. I'm going to talk to you today about the exposome and how new approaches to measurement affect the study of environment, behavior, and health. But before I do that, I'd like to tell you a little bit about where I work, the National Institutes of Health. We are the largest supporter of biomedical and behavioral research in the world, and we have as our mission statement, science in pursuit of fundamental knowledge about the nature and the behavior of living systems. But in addition to this basic science clause, we have a second component of our mission statement, which is the application of knowledge to extend healthy life and reduce the burdens of illness and disability. The behavioral component of what we do is quite important. So we have come to recognize that just a few behaviors explain about half of all deaths. And those behaviors include cigarette smoking or tobacco use, a poor diet and physical activity, and then a variety of other factors, social behaviors, risky drug use, and so forth. At a sister agency in the United States, the Centers of Disease Control has identified 6 battles in public health that are winnable battles. In other words, these are public health problems that we might be able to address through better approaches to behavior and medicine. So, for example, we're aware that HIV is a battle that we can make substantial progress against. Tobacco use is another, nutrition, physical activity, obesity, and food safety, healthcare-associated infections, motor vehicle crashes, and teen pregnancies. Here at our office, the Office of Behavioral and Social Sciences Research at the NIH, we've decided to focus on 3 major areas for our future strategic plan. One is the next generation of measurement and data. The second is delivering health services in a reforming healthcare system. And the third is training the next generation of research investigators. And I'm going to talk to you today primarily about the first of these pillars, the next generation of measurement and data, but I'm going to come back at the end and talk about training in the future. So one of the issues that has become of great importance to us is the next generation of measurement for studies in epidemiology, behavioral science, and medicine. What we've come to realize is that there are revolutions going on in mobile health technologies, in the use of electronic medical records, in system science, but also in the areas of data and data analysis. So we've come to recognize that we have masses of data, and we need to find new ways to visualize those data, and also new ways to analyze all of the information that we're gathering. Now, one way of thinking about this explosion is to think about the basic issue of genetic research and how we've made such progress in capturing the genome. So we know that our genetic backgrounds have a big impact on what happens to us in terms of health outcomes. But we might think of another component, and that is the exposures that we have throughout our lifetimes. We might call this, in complement to the genome, the exposome. And together, our genetic exposures and our environmental exposures might determine what diseases and health will eventually accrue to us. Here at the NIH, we have a lot of emphasis on the gene-environment initiative, the gene-environment interaction. And there's been realization for quite some time that genetic background has a big impact on what happens to us, but also our exposures, or our exposure biology is extremely important. The notion of exposomics, or the study of exposures, deals with the realization that lots of things happen to us in our lifetimes. So, for example, we might be exposed to food, to medicines, to alcoholic beverages, to the effects of poverty, frightening experiences, or air pollution. And in fact, these might have a profound impact on what our eventual health outcomes might be. So if you look at the genome and the exposome, we realize that these 2 factors together need to be combined for us to understand what happens to us. The problem is that there's a tremendous imbalance in our ability to measure genetic exposure and our ability to capture what happens to us in terms of our environmental exposures. So unlike the genome, the exposome is highly variable and it's dynamic and evolves over the course of time and varies tremendously from individual to individual. So again, we know that our environmental exposures occur dynamically throughout our lifespan. So we have exposures in utero, we have exposures in childhood, we have exposures in adolescence, and we have exposures in adulthood. And in fact, we have exposures in late life as well. So our problem is there's a tremendous imbalance between the precision that we get in measuring genes and in our ability to measure environmental exposures and the consequences of all of these things that happen to us. And we feel that there's a desperate need for us to restore some balance in our ability to measure exposures and exposure biology in relation to what happens to us as we measure genetic exposures. But we also know that the game is changing. For example, there are now billions of mobile devices. There are billions of sensors. There are billions of people using social networks. And so we have an unprecedented opportunity to measure what's happening to people in terms of their environmental exposures. So here at the NIH, we have been funding more and more grants in this area. This graph simply summarizes the number of grant awards that we made between 2005 and 2010 that involve some study involving mobile health devices and mobile phones. And we've been quite involved with a variety of organizations that are trying to understand how public health can benefit from these mobile health technologies. So, for instance, we participate in something called the mHealth Summit, which is an annual meeting that brings together people from the electronics industry, from the mobile phone industries, from telecommunications, and researchers who are interested in using these technologies to try to improve human health and human health outcomes. I'm just going to give you a couple examples of areas where we think that these technologies are going to have a big impact on how we study health and health outcomes. This slide comes from an investigator who's looking at methods for assessing dietary intake using cell phone technologies. We've known for a long time that dietary factors may play a big role in health outcome, but we've never been very good at measuring dietary exposures. The Framingham Heart Study, for example, studied the effects of diet on cardiovascular outcomes, and it studied diet primarily using the 24-hour diet recall. We know that the dietary recalls are actually very prone to error. This new technology shown in this slide uses the Apple iPhone, and in this case takes a picture of a plate of food, and this application and software can estimate the protein, carbohydrate, and fat in this meal. Now, we know that these technologies are not good, that is, that they have a long way to go, but the engineers who are developing these technologies iterate them all the time, and over the course of time, they're becoming much more accurate. The woman shown in this slide is holding a little box, and this woman is in Uganda. Unfortunately, she's affected with the HIV virus, and so we wanted to learn about her adherence to the medications. What happens is that when it's time for her to take the components of her complex regimen, that little box beeps and then it opens and it dispenses the pills that she's supposed to take at that particular time. On the right side of the slide, you'll see a little graph, and that graph will characterize her adherence during any particular day. And so you can see what her adherence looks like. It's worth saying that that information is transmitted over the internet. So when she's in Uganda, that information is actually transmitted directly back to the investigator in this particular study, who is in Boston, Massachusetts. There are a variety of different technologies that can monitor a whole lot of information about a person and their physiologic characteristics as well as their behaviors. So this little device fits in a pocket inside, in this case, an Apple iPhone, and is able to characterize a cardiac rate and rhythms. These devices give you an example of how it's possible to take the laboratory out to people. So we've always thought about research that involves bringing people into the laboratory. We think the next generation is going to bring the laboratory to places where people are. So on the left, we see a little device that is held in the palm of this person's hand. And this is something that is a PCR machine that allows the quick-time analysis of genetic information. You see the magnet there, by the way. So the magnet is about the size of a quarter. On the right side, this is a fiber optic microendoscope, and that can be used out in the field, in this case in remote locations, to characterize lesions. So this person has a little device that's being touched to his lip in a field environment. And on the right, you see the characterization of that lesion, which is sent off in real time for analysis somewhere very distant, another part of the world. And the bottom part shows how small the device is. So we believe that these new devices provide the opportunity to bring the laboratory out to just about any place. This microscope that you see on the right side looks at characterizations of CD4 and CD8 cells, and it's able to send that image, and that you can characterize the number of cells by traditional wet lab methodologies on the right, or by this device on the left, and they're remarkably accurate. So using these simple devices in field locations can give you information that's quite similar to what you would get in traditional wet lab preparations. Now, there are a variety of new ways that these devices are helping us understand behaviors characterized in the field. In this case, this work being done by Kevin Patrick at the University of California in San Diego is trying to estimate bouts of physical activity as a function of a characterization of parks in his environment in the San Diego area. So there are a variety of different methods that can be used to do this. Some of them involve satellite technologies that use continuous flow pictures, and others involve wearable electronic devices that either fit inside cell phones or can be worn on a person's wrist or ankle. And here you can see how much activity there is in certain areas in San Diego. And you can map that against the locations of parks in these communities. There are a variety of other technologies that are becoming available. This particular one is a little camera that can be worn around somebody's neck. It looks very much like a piece of jewelry. And this camera can take about 5,500 pictures per day. And so one of the things that's interesting about this is that using Bluetooth technology and GPS, that this device can send the location of where these 5,500 pictures are being taken, and also can actually send the pictures. And some of the pictures can be analyzed by software to estimate the proportion of time that the person is in different environments. So, for example, the number of times the person is where there are trees, like you see in the bottom right here, different areas in the community. And so we think that these technologies will provide a remarkable advance in our ability to characterize people's physical activity and their activity in relation to various components of their community and how much time they're spending outside and inside. This example, again from Dr. Patrick's work in San Diego, uses small sensors to characterize how much CO2 exposures people get as they bicycle in different areas of the community. And so the sensors are able to capture this. We're able to capture the location of bicycle riders using GPS and cell phone technology. Now, there are a variety of these technologies that can be used for intervention. And so the CHESS intervention technology, or chronic disease management technology, allows self-management programs for asthma, alcohol dependence, lung cancer to be delivered in real time with interactive software that's available on simple devices like a mobile phone. One of the big problems that we're encountering is that we know that there's remarkable advances in these technologies, that they're becoming more available, they're becoming less expensive, and a lot of people are using them. But what we don't know is how much these, or how well these technologies are affecting health behavior and health outcomes. We recently had the opportunity to look at the published literature that evaluated these mobile health technologies using randomized clinical trials. And we looked at all the trials that we could find that met certain criteria that for experimental design, randomization protocol, and so forth. We looked at the trials that were published between 2008 and 2012, and we were only able to find 20 systematic trials that were published. Remarkably, about 55% of those trials, 11 of the 20, failed to demonstrate a clear benefit of the mHealth intervention. 3 of the trials had a mixture of positive and null effects, and 6 trials, or 30%, showed a clear benefit. So again, we just think that it's time for us to do more systematic randomized clinical trials that evaluate whether or not these interventions are producing benefits in terms of human health and human health outcome. I'd like to just take a minute to talk about the problems that we face as we go to a research-based approach to the analysis of this information. So one of the problems that we have is that we're going from an era where we didn't have enough data to an era where we have too much data, or we have so much information that we don't quite know what to do with it. And here's one good example of this. This is some work that's being done by Holly Jemison, who's has been a fellow with us over the last 2 years. And Dr. Jemison is very interested in using sensor technology to capture movement inside dwellings. These are primarily dwellings for elderly people. And so here you see the floor plan of a dwelling where a person lives, and then you can see these sensors on the left. These are inexpensive sensors. These sensors are sometimes part of burglar alarms that people use in their households. They're, in the US at least, quite inexpensive. And you can line up these sensors and determine how much movement there is as a person moves around their apartment. So now we have an opportunity to capture in real time a continuous flow of people's movement within their own apartments. Now, the problem is that we have so much information, we don't quite know what to do with it. So here's an example of how some of this information is summarized. What you see here is a series of concentric circles that goes from the interior to the exterior. In each of those circles represents one day in the life of someone living in one of these dwellings. And so as you move out from the inside to the outside, each of those represents where someone is during the 24-hour clock. And so the circle you might think of as the hours of a day over the course of a 24-hour clock. You can see, for example, that between about 11 p.m. and about 7 p.m. in the morning, that the person is not moving very much, and that when they are moving, or where they are, is in the bedroom of the house. So we presume that the person is sleeping most of this time. And then you can see, for example, the times of the day that the person is in the bathroom, the living room, the kitchen, or near the front door of the house. You can also tell that as you go over the course of time, again, the days in the earlier part of the year are the times when the person, the circles toward the center of this represent days in the earlier part of the year. And you can see that as the year goes on, then the person is sleeping less. For example, you see more dots in the bedroom between 12 o'clock at night and 7 in the morning. So these sorts of clever techniques allow us to visualize data and begin to help us deal with the enormous amount of information that we're going to have in the future. So to summarize what I've said so far, what we're doing in our group is we're trying to look at ways to harmonize data, to use common tools, to use electronic records, and as I've talked to you about today, to harness the power of mobile health technologies, and also to deal with the new challenges we'll have in the visualization of data and the analysis of these big data sets. So I'd like to turn now to another issue that's confronting us, and that is, well, given that there will be substantial changes in the way that we do things, are we doing the right thing in our training programs to get people ready for this new environment? As we look at our curriculum, at least here in the United States, we think about how we're training people. we've come to realize that our training programs are inadequate. And I'm going to talk to you a little bit more today about the PhD programs now and in the future. So most of our PhD programs in this country are about 6 years long. So it takes a person between entry and graduation about 6 years to complete. So the people who will be graduating in 2019 are already enrolled this fall. And one of the questions that we have to ask ourselves is whether or not the graduates, those who will be getting their degrees in 2019, are going to have the skills necessary for them to succeed in the world that they exit to when they start their jobs in 2019. So we do know that one of the challenges for the future is going to be the need to train people in a multidisciplinary way. So if we look at the interactions between our sciences and other sciences, there's much more dense interaction between behavioral and social sciences and biological sciences, but also all sorts of other sciences, life sciences and physical sciences as well. And so the training programs of the future are going to need to take into consideration that the skills people will need will be much broader than they're getting in the current programs. We know that most of the PhD programs that we have, at least in the US, are focused on training people to be university professors. So in this country, we train about 50,000 PhDs per year, and the great majority of those in the past have gone on to work in university settings. But we suspect and we find likely that in the future, about half of the doctoral degree holders are going to be working in fields outside of academia. And somehow we have to adapt our programs to get people ready for that. Here at the NIH and our sister agency, the National Science Foundation, we support, pretty close to 44,000 PhD students per year, and a variety of other U.S. government agencies support PhD students, getting the number up to about 50,000 that are supported by these federal programs. And we believe that because of that, we have the opportunity to get people to think a little bit differently about how they might be constructing these programs for the future. So one of the things that we do know is that we're training people to be within silos. And if you think about the way we do our basic education, people start out in elementary school together, and they go on to their basic junior high school, and into college, pretty much as a group. All people are together. But then we usher them off into the silos, the specialty training, and we have to find some way to pull them back together again. We also need to think about how much postdoctoral training we need to offer. So we still need to train people in all the fields that they've learned, that we've been teaching them over the course of the years. So their basic methodologies and theories in the areas that they're exposed to. But we're finding that more and more we're going to need to train people at the postdoctoral level, perhaps to get this interdisciplinary exposure. And in the behavioral and social sciences, we've been doing this much less so than the other sciences. So we need to put much more thought into whether or not we need to invest more in postdoctoral programs and what those postdoctoral programs will look like. So if you think about the current program for most PhD programs, most of them are focused primarily on training professors. They're disciplinary focused. They're focused primarily on training people to be psychologists or sociologists or anthropologists, and that they are training people primarily in using small data sets, a lot of original data collection, and using non-harmonized measures. We still are encouraging people to develop their own measures for most of the problems that they study. And these investigations emphasize sample statistics, primarily the analysis of variance and regression. We think that the PhD programs of the future are going to be different. They're going to train people for a wider range of job opportunities. They're going to be focused more on team science. They're going to be preparing people not for disciplinary work that is within a single discipline, but more for multidisciplinary work. And they're going to need to consider a variety of different methodologies. They're going to need to consider the big data, the enormous data sets, the use of harmonized data measures, the use of data linkage, statistical technologies that involve pattern recognition as opposed to hypothesis testing, and a much greater use of engineering techniques such as system science. So, in order to get from where we are now to where we want to go in the future, we have to ask a series of important questions. For example, are we training the right number of PhD students? Are we overtraining? Are we training people for situations where there might not be enough jobs? Are we training people for the appropriate range of employment opportunities? And we have to look at whether or not we are providing the right number of postdoctoral fellowships. We also need to look at interdisciplinary training and multidisciplinary training and determine whether or not that training should occur at the predoctoral level or the postdoctoral level. And we need to ask the question, are the students that we're admitting this year going to be ready for the research careers that they're going to exit in the year 2018 or 2019? So to conclude, in the words of Jerry Garcia from the Grateful Dead, a popular band in the United States, Mr. Garcia argued that someone has to do something, but it's just incredibly pathetic that it has to be us. So thank you so much for your attention today. Once again, I'm sorry that I can't be there with you in Italy, and I hope we have the opportunity to discuss these ideas further at some time in the future. Thanks once again.